young people around the world are experiencing more mental and physical health conditions.
I was diagnosed with type 1 diabetes when I was only 7 years of age, hypothyroidism at 8. Epilepsy struck me like a lightning bolt when I was 15 years of age. And I also underwent a failed brain neurosurgery. For me, living with NCDs isn't just some abstract concept or a health term. In fact, they shaped my whole childhood, my education, my identity, how I live my life. While other children of my age were learning to play, I was learning how to manage all the syringes as well as those seizures and the stigma, the discrimination from the society. Over time, I realized that these conditions are not just about the body. In fact, they also have a toll on our mental health.
Research shows us that early life stressors, especially those involving family functioning and dynamics, have large impacts on our health across the lifespan. These impacts include mental health conditions like depression and anxiety, as well as physical health conditions like hypertension, diabetes, and heart disease.
Through my research and design work, I've seen how often children and adolescents living with health challenges don't get enough support for their emotional well being.
I've also seen the stigma that surrounds it in both professional and personal settings.
Non-communicable diseases and mental health challenges are closely linked in Papua New Guinea, especially for children and young people. Many families face stigma and limited services, which inspired me to focus on integrating mental health support into healthcare systems in my country.
Mental and physical health are a two-way street, and the way that young brains develop in response to early life stress can influence the risk of many health conditions later on. Family dysfunction can cause toxic stress for a child while their brains are in this crucial developmental phase, and it can impact their stress response when they're older as a result. Unfortunately, parents globally do not receive enough support to meet the many social and financial pressures that they may face.
I think it is important that we step forward to break the stereotype and support such patients and their families.
This gap motivated me to think creatively about new solutions like using virtual reality to make therapy more engaging and accessible.
We have created a set of evidence-based recommendations for actions at multiple levels to support parenting in the interest of building healthy societies.
My hope is that readers see that with creativity and exploration, there are many ways to approach mental health care for young people. Celeste is one example of how we can combine technology, culture, and play to support resilience and hope.
I really hope that with this compendium, marginalized voices are highlighted, such as those of patient and caregiver perspectives. These are often overlooked in the bigger scheme of things, but are crucial in advancement of research, policies, and practices to improve the quality of life for patients with non-communicable diseases and their families.
I hope this compendium helps others see mental health as essential to overall well-being and inspires actions to create safe, accessible space for families.
I'd like people to walk away inspired to think outside the box in addressing mental health for children and adolescents and people all around the world.
There is no better investment in our future than in our children and those who care for them.